jeepers, how many times do I now think, oh, we are fearfully and wonderfully complex. We really are. This is not how vision works. It's not just a case of flipping the image, and I'll prove it to you with vision. So when you look at this, if you look, there's one square that's got the letter A on it, one that's got the letter B, and then we would hopefully, in fact, raise your hand if you see square A to be darker than square B. Fantastic. There's a few of you with a very embarrassing neurological disorder, or you've had bilateral arm amputations, and I apologise for that insensitivity. Look what happens if we will reproduce those two things there. A and B are actually identical, but you don't see it like that. But look at what happens if you turn your head on the side. Nothing. There you go. But look what happens now. We're going to move A onto the A square, and we're going to move B onto the B square. And then we're going to move A over onto the B square. Just watch that go over there, and look, they're clearly identical. We'll move B back up to the A square. Clearly identical. This is not a PowerPoint trick. What you're seeing is not what's hitting your retina. What's really happening? Well, these two identical shades of grey hits your retina, goes to the back of the brain, sure, but then a whole lot of groovy stuff happens. And it happens so quickly. And you don't know what's happening. It's instantaneous. Effectively, the brain is recruiting everything it knows. What does this mean? What will be advantageous to me right now? Same thing happens with pain. So for those of you who don't know much about musculoskeletal stuff, this is not a normal situation for this man. Something dangerous is happening in his right leg, and his brain has to ask the question, what does this really mean? How advantageous is this? And hopefully the brain will make his leg hurt. And therein is the drum. Therein is the rub. The drum rubbing bit is that pain is an output of the brain. It does not exist until it exists. It doesn't exist in your body, never does. It's a production of your brain. It's all about meaning. This is how one fellow coped with his shark attack amputation. It's all about meaning. So how does it happen? Well, pain emerges with activation of a thing we call a neurotag, which is a network of neurons. And we can say, okay, there's the network of neurons, and when you activate them all together, bang! Very conveniently timed sneeze, whoever that was. Bang! There's pain. And these neurotags, which are networks of neurons, share brain cells with each other. That's how we're so efficient as a brain, if you like. For example, if we focus on this particular brain cell, which is part of the pain neurotag, and I call it a neurotag because it's like a signature, like a graffiti artist has a signature. It's like that, this network of neurons. It's different in all of us, and it's different for different pains. But the brain cell that I've circled there might also be involved in the representation in your brain of beliefs about your back. Let's say this is the back pain neurotag, and this is the beliefs about your back. If you think your back is a fragile, easily breakable, slipped discable sort of a thing, then that brain cell will have a role not in just representing that, but in just increasing the excitability of the back pain neurotag. It might also share brain cells with thoughts and feelings about your back. Expectations about what this means. Well, Aunt Martha fell over in the supermarket and she ended up in a wheelchair. I've just fallen over in the supermarket. And it was interesting looking at Jeffrey's lovely presentation and seeing the slide of thinking errors. And you could apply all of those to the patients that I see with chronic pain at different times. Catastrophic interpretations. This will never get better. Any credible evidence of danger to your body will manipulate this. And if there are any musculoskeletal physios or doctors here, I know that you will have one of these models. Just think what's happening inside the brain of a patient with back pain when they walk past your desk. And they see an intervertebral disc sitting on the desk having slipped right out of the spinal column. And the good thing about these models is that you can have a left-sided slip or a right-sided slip, and you could pick that up and just throw the disc across the room. Clearly don't bend over, because if you do, it might just hit the person behind you. Any credible evidence, the look on your face as a clinician when your patient tells you the story, or the favourite from orthopaedic surgeons. It was a real mess in there, but I think I've cleaned it up. You've got the knees of a 75-year-old. Shit, I thought they were mine. What happens in the brain when pain persists? Well, lots of things happen in the brain, and we've heard the theme already in these 2 days. Neurons that fire together, wire together. So there's 2 things that happen in the brain. One is that this neurotag that produces pain becomes more sensitive. We know that if you have back pain for 25 years, and there are many people who have back pain for 25 years, watching someone else pick up a box makes your back hurt. And we do a brain scan and we can see that you're not lying. You don't just think it hurts. If you think it hurts, it does hurt. So over time, this network just becomes stronger and stronger. And Jeff's already talked about these ideas of habits. And there is a very compelling argument to say that pleasure and pain share a lot of the same neurology. We did a very interesting experiment when I was in the UK where we got sadomasochists. And we looked at their brain activity in 2 different situations when we put a hot poker on their leg. One situation was me on a recording saying, "And now I'm putting the hot poker on your leg. Can you feel it?" Yada, yada, yada. And the other was exactly the same script read by a mistress. And the brain activation was similar but slightly different in one key area. But the experience moved from pain to pleasure. Now, these people don't find pain pleasurable. They find noxious stimuli in that context pleasurable. They're not hurting because they're in pleasure. That's the distinction between pain and tissue damage, or nociception is what we call it. So when pain persists, we get increased sensitivity. We also get decreased precision, and that's a real issue. Normally, these brain cells want to be activated in a very precise fashion, and that gives us a very precise output. When my son, Lord Adorable Squeaky Pants, which is not his real name, was learning to say the word isosceles, it was a great example of the brain learning how to inhibit unwanted brain activity. Because for a long time he could not say it, he would say allosceles, isosceles, drum rubber. He couldn't get it. And the problem with that is that he probably had the constituent brain cells, but he could not inhibit the extra ones that were also firing. Until one day when he got it. We were driving in the car and I said, "Have a look at that shape up there, Gubs. What do you call that?" He looks at it and he says, "Oh, it's a triangle." "What sort of triangle is it?" "Isosceles." I get goosebumps remembering that time. The look of satisfaction on his face. It was a rectangle. When we have pain for a long time, this effect of reduced precision is that the pain starts to spread. So here you can see I've circled some green brain cells that are activated now whenever that neurotag is activated. And if those brain cells are in a part of the brain that represents your body, for example, primary sensory cortex, now the pain is spreading, or it's moving, or it's changing. And if we don't understand the complexity of pain and the plasticity, the changeability of the brain, then we would have to conclude the body is becoming more damaged. And that's an erroneous conclusion. So we need to reconceptualise what we understand chronic pain to be. What do we do about it? Well, much of my research is really trying to address this question. And I'm emphatic about this, that people need to understand that their pain is 100% real. It's unpleasant, it's horrible, it's debilitating. But it is no longer an accurate indication of the state of the body because the system has changed. We do a lot of work teaching people how to get under the radar system of a very sensitive nervous system that's on the lookout to protect them. We can use tricks to help convince the brain that things are different. Here's an example of that. We did an experiment with people with a condition called reflex sympathetic dystrophy or complex regional pain syndrome. They have a very painful hand and they do all these hand movements, and when they look at their hand during the movement, their pain gets worse and their swelling gets worse. And they look through 2 little tubes like a magnifying glass, and as my daughter, Princess Petunia Cake, features, not her real name, would say, well, that's hardly rocket surgery. Nothing changes. However, if you look at it through a magnifying glass, the increase in pain is magnified. They're not doing anything different. The increase in swelling is bigger. So the hand is doing exactly the same thing. It's the influence of the brain's perception of the hand. The groovy finding of this study is that one there, that when we turned the binoculars upside down, the increase in pain was drastically reduced and the increase in swelling was reduced. The cool thing, I guess, the area that excites me at the moment is that we can retrain the brain to regain precision. And we're getting good symptomatic and functional advantages. We don't solve the problem, it's not as simple as that. But we're starting to make gains now that we couldn't before. I'd like to thank you very much for having me, to the organisers for having me, but also go to Movember and either sponsor me for this thing that I'm doing with Courage or someone else, because it's a great cause. Thanks for having me. Thank you.